Okay. Hello, everybody. My name is Abu Jamil Faisal. I'm a public health physician working in Bangladesh, and I have quite a length of experience of 43 years working in public health areas, different areas. Today, I'll be proposing a proposal according to the ADB Path Innovation Challenge, which has been recently announced under the title of Innovations for Non-Communicable Diseases and Mental Health Management in Primary Healthcare. So our proposal title is Community-Based Remote Patient Monitoring System for Non-Communicable Diseases. Um, just to give a brief background of this proposal, I mean, this has been structured to address the challenges of NCDs, and it would be a community-based remote patient monitoring system focusing on individuals with the major NCDs like the cardiovascular diseases, hypertension, diabetes, or those people at risk of developing this condition. We will develop a community-based remote patient monitoring system that would allow the healthcare providers to remotely track patients' health parameters in real time. The system will integrate with wearable devices, smartphones, and other digital health tools to collect data such as blood pressure, blood glucose level, blood cholesterol levels, physical activity, sleep patterns, and mood fluctuation. By promoting proactive monitoring and personalized care delivery, this solution can empower patients to manage their health effectively and reduce the risk of morbidities and mortalities associated with NCDs. Let me show here the health infrastructure in Bangladesh. This is quite unique that at all the level there are different uh, facilities available. We actually intend to start at the lowest level, that the community clinics, where these community clinics are located in the villages. There are 13,500 community clinics throughout the country. For every 6,000 population, there is one community clinic. It's kind of an outpatient department facility. It is managed by a paramedic who is known as the community healthcare provider. So they would be actually be collecting the data because they receive patients every day, and through different means the data would be collected, and then that would be passed on to the cloud where that would be these would be stored, analyzed, and then at the Upazala Health Complex, which is a 30 to 50 bedded hospital with 9 to 11 doctors and specialists and lab technicians and so on. These the doctors located at the Upazala Health Complex, they would be able to see the data and provide the guidance and prescriptions and so on. So I will move on to show the proposal initial target. As I mentioned, the initial target would be the community clinics where the community healthcare providers would be located, and the data would go up to the Upazala Health Complex. We want to point out here that there is a benefit of using the community healthcare providers because these community clinics have already received a government provided tablet, and the community healthcare provider, they have the basic knowledge of reporting online using their tablets. So the different steps of the proposal: first step is the registering with the community healthcare providers, and once the community healthcare providers would register the patient or the person, they will be provided with the gadgets, the patches, and the other things. And then on, the data would be acquired. Data acquisition will start happening. Real time data would be happening, and that would be stored at the cloud where the processing will be actually happening. and the analysis would be also happening. That is step 4. And through this analysis, the personalized health management system would evolve. Finally, we intend to harmonize with the government health data system, that's the DHIS2, and as such, this would become a part of the DHIS2 eventually. Let me give a picture view or bird's eye view of the whole thing. First, the registration with the community healthcare providers at the community clinics. That's the community clinic. So once the patient or the person is registered, their person would be provided with patches, digital patches, and the chips and so on, and that those patch wearable devices would actually collect the data, which would be stored in the cloud, because there are already in the country, I mean, there are mobile phone operators through whom the data would be actually stored in the cloud, and then it would be also processed there, and it would go from there to the providers located at particularly the doctors located at the Upazila Health Complex. And so back and forth, the doctors would be able to see the data, the personalized data, and also the community healthcare provider located in the community clinic. They will be able to see the data. The doctors, according to the data available, they would be able to provide guidances and also prescriptions. And in that way, a personalized health management system would actually evolve, particularly for the NCDs. Um, we have thought that how this would actually proceed. First, the product development stage. I mean, that would be the stage where we will have to customize the patches that could be actually be weared by the patient. Integration with the mobile operator towers, because they have all the control of the towers, so that would the, the data that would be generated from the patches would have to be integrated with the mobile operators towers, and through this the remote patient monitoring system would be developed. This would be definitely put into an operational phase. It will pass through an operational phase, and a refinement would actually be happening. By following the above steps, we can successfully customize and operationalize our remote patient monitoring system for NCDs, which would provide valuable insight and support for patient and healthcare providers alike. Um, the we will have to we'll have to follow a roadmap, which according to the guidance provided in the call for the proposal, we will have to present to the disease management committee, and then a final proposal collaboratively would be developed. Meanwhile, the team would be also finalized. Training and implementation would happen of all those who would be involved, and then evaluation would be a continuous kind of an evaluation, and optimization would be happening. We'll have to keep in mind that we'll have to obtain regulatory approvals from the government. There are a couple of the departments which will be involved in getting the regulatory approvals from them. So we are proposing a small team here of 5 members. The team leader is myself, Abu Jamil Faisal. We intend to use a healthcare provider, a healthcare professional who has an extensive experience working in different areas of the health. His name is Rizal Karim. There would be a project manager named Mahmoudur Rahman, who is also a biotechnologist, so he knows the how to organize the different systems. Then we would be using a data scientist. His name is Mohammad Liaquat Ali, and a software engineer, because a lot of software issues would be there. And his name is AHM Muzaddek Karim. So I would stop here and say thank you to all those who have listened to it.